Okay, so just wanted to sort of touch base with regard to COVID. We thought we were kind of out of this whole mask thing, and then the CDC comes in with its new guidance. Just recently in the past week, CDC is now saying that fully vaccinated individuals should be wearing masks indoors in areas that have high or substantial community transmission. They haven't changed their stance on unvaccinated individuals. They should be wearing their masks pretty much all the time, right? What does this mean for employers? Well, it really depends where you are. That is something, CDC actually has something on their website where you can go in and drill down certainly to the county level and see what kind of transmission is going on in your county. I just did it for Montgomery County, Pennsylvania, and we're not considered high or substantial at this point. So that obviously could change with the Delta variant, but something to think about from an employer point of view. Do you want to reinstitute masks? And I know that's a hard thing to do. It's also a hard thing for the governors to do. We haven't seen any movement yet from Pennsylvania, New Jersey, Delaware, any indication at all that the mask mandates are going to change. I think now that your employees for the most part have gotten used to not wearing masks, it's very hard to go back, but it is something certainly to be thinking about, particularly if you know what your vaccination status is in your workplace. You've heard me for months say, I think it's a great idea to track vaccination status, get copies of those cards. And that way, at least you understand as an employer, do I have 30% of my employees vaccinated, or do I have 80% of my employees vaccinated? And that can help you really understand your risk. Also, in the same guidance, CDC is updating their guidance on testing. They were saying before that if you were fully vaccinated, you did not need to test after exposure, but now they're sort of going back on that and saying, yeah, you probably should test, because if you've been reading the news for the past couple of days, there's some documents that have come to light that say that people who are vaccinated actually can still carry a substantial amount of viral load and can spread COVID. So we thought originally that maybe that was not the case, or that it was unlikely, but unfortunately, at least with the Delta variant, it looks like the vaccinated can spread just as easily as the unvaccinated, or almost as easily. So now we're talking about testing and 14 days post-exposure to not necessarily quarantine, but wear a mask until you know for sure if you have COVID or not. So again, just measures around stopping spread. So something to think about in your own workplace if you have guidance around what happens with employees who've been exposed. And then we've been talking for months about the carrot and stick approach when it comes to vaccination. We've kind of stalled out a little bit with regard to where we are as a country on vaccines. And so, although I think some places are seeing a little bit of an uptick because some states in particular are seeing surges in COVID. So I think the federal government is itself getting into the act here and probably quietly pushing states, localities, and private industry to try to get into the game as well and encourage people to vaccinate. So President Biden announced that the government will require employees and contractors either to be vaccinated or undergo regular COVID testing. We've also seen something similar from New York City. I also saw, since I created this slide, New York State is doing something similar. Department of Veterans Affairs is going to require all of its frontline healthcare workers to be vaccinated within the next 2 months. And then California is doing similar to what New York City and New York State are doing, either get vaccinated or face the weekly testing. And I think the hope and the thought there is, if you have to be tested, that's going to encourage you to go ahead and get vaccinated. That might be the push that people need. We're also seeing it in private industry, and I haven't even listed all of the companies, but I've seen a bunch. So just on the tech front, Facebook and Google have announced that if you want to come back to the office, you need to be vaccinated. A lot of large law firms have made the same announcement. And then in the entertainment sector, Netflix is requiring vaccination for all actors and employees who come in contact with them. MGM Grand has said unvaccinated workers must regularly test for the virus. And if they're positive, they're going to quarantine without pay. So again, another, that's a little bit of a stick there, trying to get people to come out and get vaccinated. Wall Street, largely the big banks are saying you've got to be vaccinated to return to the office. And then also it's just some various companies here listed in that last bullet point I've also seen that Walmart's corporate employees, they're going to require vaccination, not the stores yet, but other various employers like that. I also just saw a headline as we were getting on the webinar this morning. I know Broadway is reopening this fall. They're going to require vaccination, proof of vaccination for you to come and watch a show. They're also going to require it for the actors and the people who are involved in the production. And now I'm seeing New York City. This just came on while the webinar has started, that I saw it on my phone, that New York City is going to start requiring essentially vaccine passports or is going to allow private industry to require vaccine passports for things like restaurants and other private. Tuned on that. I will not be surprised if we see lawsuits around that, but it should be pretty interesting. Along those lines as well, Department of Justice just came out with a guidance saying that they support the idea of mandatory vaccines as well. So we've already seen one federal court down in Houston say that it was okay for a healthcare system to require mandatory vaccines. Now we've got the federal government saying we think that's okay too. So again, stay tuned. It'll be very interesting to see how all of this plays out. And then I did mention this last week, but I wanted to mention again, July 26th was the 31st anniversary of the Americans with Disabilities Act, and President Biden on that anniversary announced a guidance that extends ADA protection to people with symptoms of long haul COVID. There is a guidance memo from the Department of Health and Human Services and the Justice Department to that effect. So this is just something to be thinking about as employers. If you have an employee who approaches you about reasonable accommodation and what they're suffering from or long haul COVID type symptoms, again, don't dismiss it out of hand. You need to go through a reasonable accommodation interactive process with them. And if you need guidance on how to do that for members, obviously the hotline and member legal services are there for you. That's all I have for the week. One thing I wanted to mention before we go to questions, if you have topics that you really are interested in knowing about, you want us to cover in a future town hall, please send us a chat or send it in the Q&A. Then how about Kevin, any questions come through?
Yeah, there's one that came in that it's a great question. We're saying that a lot of employers are saying you have to be vaccinated to come to work. What about that employee that doesn't want to come to work, so is not getting vaccinated? Really? Yeah,
I think that's a really interesting question. I've had the same thought that the employee might have thought about getting vaccinated, but the promise is now they can work from home if they don't get vaccinated, or maybe they get vaccinated and they don't tell the employer, they don't offer the proof. So you really have to think about how that plays in with your workforce. Is that something you want to do? And is there a bigger stick sort of at the end of it, which is you can't come to work, but we're going to give you 3 months to get fully vaccinated. And if you can't do that, then we're going to terminate your employment. So it's something to think about how it falls into the context of your employer.
And I think it may lead people to start thinking about their job descriptions as well. So really look at some jobs that do require in-office and making that a requirement, which is the other way to get, and I think that's that mandatory vaccine case you discussed was about a safety standard. And I think sounds like with what the federal government's doing, you can broaden that mandatory beyond purely a health and safety kind of requirement. But
right. Also for employees who travel, think about that in your job descriptions as well, because we're going to have plenty of companies saying we don't want your consultant here, we don't want your salesperson here unless they're fully vaccinated.
Yep. So maybe next week we'll keep a little bit more time and think through some of these kind of situations. Because as you were just talking, I'm like, well, what about this? What about that? And I think, again, this is that dynamic thing. And that's why we meet every week, because each week we have another piece of information or example. Maybe we'll delve a little bit more into these next week with time permitting. So, well, thank you all. We're at our time limit. Amy, thank you. Emeka, thank you for joining us today. And I hope everyone has a great week. Take care.